Good morning, everyone. My today's topic is diabetic foot ulcer. Learning objectives. At the end of the session, you will learn the definition of diabetic foot and diabetic foot ulcer to identify the common points and pressure areas at risk for foot ulcer, the pathophysiology of diabetic foot ulcer, the etiology of diabetic foot ulcer, and holistic management of diabetic foot ulcer. The facts of diabetic foot ulcer. 25% of patients with diabetes type 1 or type 2 will develop one or more diabetic foot ulcers in their life. Diabetic foot ulcer may lead to temporary immobility, infection, risk of hospitalization, and amputation, also increasing risk of mortality. Diabetic foot definition: infection, ulceration, or destruction of tissues of the foot associated with neuropathy or peripheral artery disease in the lower extremity of a person with a history of diabetes mellitus. Common sites and pressure points of diabetic foot ulcer are the top of the toes, bottom of the toes, pad of foot, heel of foot. What is diabetes foot ulcer? Diabetic foot ulcer is one of the major complications of prolonged diabetes. It is a wound that occurs in approximately 25% patients with diabetes and is commonly located at the bottom of the foot, caused by loss of sensation, poor circulation, and external factors such as poor fitting shoes or injury. The stages of ulcer development is the callus formation, the subcutaneous hemorrhage, breakdown of the skin, and deep infection with osteomyelitis. Peripheral neuropathy is a damage to the nerves due to high blood glucose, that is diabetes. Diabetic neuropathy is a common factor in almost 90% of diabetic foot ulcers. Types of nerve damage are sensory nerves, motor nerves, and autonomic nerves. Peripheral artery disease is a dysfunction of the large blood vessels, the small vessels. The lack of blood supply leads to failure of the natural body defense, resulting in an increased risk of infection. Approximately 50% of patients with peripheral artery disease develop a diabetic foot ulcer. Etiology of diabetic foot ulcer. In most patients, peripheral neuropathy or peripheral arterial disease play a central role in the development of a diabetic foot ulcer, accompanied by external trauma such as poor fitting shoes or injuries. In neuropathic, the foot has diminished sensation. The ulcer due to the peripheral neuropathy, often located in a weight-bearing areas of the foot such as the metatarsal head, the heel, and over the dorsum of the clawed toes. It is warm with good blood flow and palpable pedal pulses. Ischemic. Absence of pulses indicating foot ischemia. Ulcers are often at the tip of the toes, nail edges, between the toes, and lateral borders of the foot. It's typically cool. It neuroischemic. It is a combined effect of diabetic neuropathy and ischemia. Ulcers are often in the margin of the foot and toes. Gangrene may be present. Critical signs of ischemia: pink, painful, pulseless, and it's typically cool. Holistic management of diabetic foot ulcer. Assess the patient holistically. Assess for other disease, physical and mental health. Psychological circumstances. Diabetes control, blood pressure and cholesterol status, smoking, nutritional status and mobility, pain and stress, previous history of ulceration. Remove the shoes, socks, bandage, and dressing. Assess the foot at the risk for foot problem. Check for callus, cracks, low leg edema, foot deformities, previous amputations, or gangrene. Check for the color, erythema, temperature, dry skin, eczema. Inspecting the nails between the toes. Holistic management of diabetic foot ulcer. Two simple tests for neuropathy. The 10-gram monofilament is used to detect the presence of sensory neuropathy. It should be applied at various sites along the plantar aspects of the foot and the tuning fork. Standard 128 Hz is used to test the ability to feel the vibration. Palpation of peripheral pulses, the femoral, the popliteal, and the pedal pulses. Doppler assessment and the ABPI. Toe brachial index. Consider oxygen assessment with transcutaneous oximeter. Potential referral to the specific for a full vascular assessment. Assess and manage. A detailed assessment will help you to diagnose the root cause and treat the wound better. If the cause is infection, manage it. If it is vascular, treat it. If it is compliance, educate. Holistic management of diabetic foot ulcer. Assess the wound bed status, the size of the wound, the exudate, the wound edges, surrounding skin, check for maceration, erythema, edema. Expose bone, tendons, joints, capsules, or orthopedic implants. Pain, the location, the frequency, the cause, the type, and the intensity and duration, and the odor. Accordingly, select a dressing which is suitable for wound type. For example, an exudate wound may need foam or hydrofiber dressing. A dry wound may need a moist or a gel dressing. Holistic management of diabetic foot ulcer classification. Two systems are widely used. The Wagner diabetic foot ulcer, which grades the grade classification system. University of Texas diabetic foot ulcer classification system. Prevention. Cornerstones of foot ulcer preventions are identify the at-risk foot, regularly inspecting and examining the at-risk foot, educating the patient, family, and healthcare professional, ensuring the root wearing of appropriate footwear, treating risk factors for ulceration. Prevention to identify if they are at risk for the foot ulceration, including doing the following: history from previous ulceration or lower extremity amputation or claudication, the vascular status, palpation of the pedal pulses, or loss of protective sensation. For LOPs, assess using the following techniques: the pressure perception with the 10 grams monofilaments and the vibration perception with 128 Hz tuning fork. Prevention. All footwear should conform to foot structure or foot biomechanics of the person's foot. Footwear should be sufficiently wide to accommodate the foot without excessive pressure on the skin. Appropriate footwear at all times, either indoor or outdoor, will help to reduce the risk of foot problems. Prevention. The following risk factors to consider are as follows: removal of the callus, protecting the blisters or draining them if necessary, treating ingrown or thickened nails, and prescribing antifungal creams for fungal infection. Thank you.